मैं मर्डर नहीं किया, मैं रेप नहीं किया, ये मेरा लाइफ है, वो मैंने को लव किया, हम दो लोग को जाके शादी किया, हमको काउंसलिंग दे रहे हैं, ये नहीं है, ये हमारा भारत संस्कृति में दो लड़की को शादी कर सकता है.
Because of the societal expectations and my parental expectations, people got me married. And after living in a marriage for about 12 and a half years, and after birthing 2 kids, I came out as a man because I no longer could hide my identity. Then began the journey of me becoming me.
The largest challenge has been even the awareness of the medical community. So despite the fact that they go through like 5 years, 8 years of curriculum reading, the acceptance of like gender identity within this whole space of biology has not been yet there. But what happens with trans people is not just a lot of like taboo and a lot of uncomfortable questions and a lot of uninformed information, but direct denial of the service, saying that your biology does not come in our books, so we don't understand what this is about.
और हॉस्पिटल्स में भी सर्जरी करते समय ट्रांसजेंडर वार्ड नहीं है अलग से, तो अगर ट्रांस वुमेन सर्जरी करने जाता है तो वो मेल के वार्ड में रखते हैं और ट्रांसमेन को फीमेल वार्ड में.
A mess, to put politely. Most people, if they're going for surgeries and they're recovering in the women's ward, and I've been with people helping them recover, and it's a zoo. It's terrible. It's more traumatic than the operation you've done entirely.
In one of the clinics, the gynecologist sexually assaulted a transmasculine person. These are unethical procedures which is happening across, not just in Tamil Nadu, it is happening across India as well. All of these has to stop.
That person may be just asking me a thing that, okay, why is your son wearing lipstick? Do I have the courage to tell him, yes, he does like lipstick and there's no issue about that.
ऑटो ड्राइवर पूरा लोग आको हमको मार दिया, मन को, मेरा वाइफ को. वो एक चैलेंजिंग है. वो टाइम में बहुत लोग डिसाइड किया सुसाइड करने का. बोलने की इजी है बट बड़ा चैलेंजिंग है. सो ये जेंडर हेल्थ का किधर बात करने का को कुछ भी नहीं मालूम.
Immense need for the medical professionals to understand the difference between gender and sexuality is the need of the hour. Thereby, transmasculine persons are not abused.
The government is making efforts to basically sensitize the health system and also bring in sensitization in the medical education or health education. But I think we are at the very initial stage. And because of this issue, there is a lot of stigma and discrimination that is experienced by the community while accessing healthcare.
I think the biggest urgent need is government's policy action on including trans-affirmative healthcare within the Ayushman Bharat Yojana and within the insurance policies, right? Considering trans-affirmative healthcare as like cosmetic surgeries or not necessary things is something that's been very harmful for the community, because then you end up paying a huge amount to plastic surgeons, huge amount for your mental health care, whereas this is like a very basic need for the community to ensure their well-being.
But I don't think there has been enough push from the government to make those changes. Technically, we're supposed to have them. We have the Trans Rights Act, right? We're supposed to be having access to safe healthcare and all these clinics. None of that is happening. Support is something that really changes a person's coming out journey and transition and identity altogether. It makes or breaks a person, and that impact on mental health is wild.
Today, particularly hearing about, I was really struck by people talking about, the importance of not just having access to any healthcare, but the quality of that care, the sense that people had that they were being kind of experimented on or treated as guinea pigs by surgeons who didn't necessarily have the clinical training needed to actually perform surgery well. And I think that's really important, especially it's great to see the government here taking real initiative around increasing access to care, but that has to be matched with an attention to the quality of that care, and then access to surgery, and not just any surgery, but with qualified surgeons who have been trained in how to perform the surgeries that transmasculine people need.
For me, being trans is just being myself, completely accepting my masculinity, my femininity.
It's more to do with me accepting myself and my body and my thoughts and my actions just the way they are, where I am, and not performing femininity or masculinity.
And what I note today came from that space where I said, okay, let me unlearn whatever has been told to me.
The future needs to have more access to sexuality education beyond just, oh, this is your identity, you should look into this and look into that, in terms of what transition means. And it was just nice to be around people who looked like you and felt like you, and being able to discuss challenges beyond that, of like actually what is just happening in your life.
It was the adults who were creating the confusion, but as far as diversity, equity and inclusion goes, this is our DNA, and we need to own it.